Yeah, hello, good evening. How are you doing? It's 8:01 p.m. here in Nigeria. Welcome to Ask the Doctors. This program holds every Sunday by 8 p.m. West African time. My name is Dr. Frederick Unmibohai. I'm a licensed medical doctor. I'm the host of this program. My co-host is Dr. Irobonose Osaze Israel. I'll be bringing him up very soon. And the funny thing is that today happens to be his birthday. So when I bring him up, I want you all to wish him a happy birthday for me. We're talking about cervical cancer today. Cervical cancer. And if you don't know about cervical cancer, you want to ask questions about cervical cancer, you can ask us today. I have Dr. Israel already in the house. I'm going to bring him up very soon. Now, if you can hear me, you can see me. I want you to tell me, where are you watching me from? Can you hear me? Can you see me? We are live on Facebook. We are live on YouTube. Today also happens to be the final of AFCON. So I know that I wish I could be watching the match, but I'm here with you. Don't worry. We'll look for a way to manage both of them. Yes, yes, yes. We have people here watching us. Diva, good evening, Diva. How are you? And happy Sunday. Let me bring up Dr. Israel. Let me bring up our birthday boy. Yes, let me bring him up. Dr. Israel, good evening. Happy Sunday. Happy birthday to you.
Good, good evening. Good evening. Happy Sunday to everybody. Dr. Fred, why you dey laugh?
Yes, yes, yes. Today is Dr. Israel's birthday. And I don't know, have we had a live session where it was somebody's birthday? I think it's the first time we are having a live session and it happens to be somebody's
This
birthday.
is
Abby? This is the first time. Yes, 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 yes.
yeah.
Dr. Israel, yeah, somebody's saying happy birthday to you. Diva, that is watching us from France, says happy birthday, Dr. Israel. Yes, yes.
Thank you
Kelvin is
so
also.
much.
So, Dr. Israel, how did you celebrate your birthday? Quickly, before we start. Yeah, tell me.
Well, the celebration is still about to start. We never even start and we still the plan how to start them.
Oh,
But all
yeah.
thanks to my beautiful all thanks to my beautiful and lovely wife. He don't put
Yes,
things,
yes, yes.
he don't put table set. Don't arrange
Uh-uh.
everywhere for me.
Okay,
Make
so when I
make I finish this program. I go
when we finish,
make I
I
go
dey come collect my
make
own. I
I
dey come
go.
collect my own.
No, no problem, no problem, no problem.
Yes, happy birthday. Yes. Good evening. Welcome. Now let's go straight to the business tonight. Cervical cancer. Cervical, a lot of people have heard about cervical cancer. Some don't even know about cervical cancer at all. Why cervical cancer? What is cervical cancer? Please send our cake. No problem. We'll send the cake. No problem. No problem. Laddie, good evening. How are you? What is cervical cancer? I'm going to start a little introduction. I will hand over to Dr. Israel. We'll make it conversational and we'll start taking your questions. Yes, yeah, that's what we're going to do tonight. Let's try and see if we can make it conversational. I don't want to make this discussion tonight like a class. Let's just talk generally about cervical cancer and all the questions and all the comments we have been seeing. So I'm going to start on this note. Dr. Israel will now go back to our usual pigeon. But because I'm starting, when he goes to pigeon, I will now switch to pigeon. Do you understand, right? Now, cervical cancer. The funny thing about it is that a lot of women don't know about cervical cancer. It's so sad that most women lose their life because of cervical cancer, a cancer that can be prevented, a cancer that can be treated, a cancer that is caused by an infection. And there's a vaccine to help women prevent it. So it's sad and it's heartbreaking that so many women, and most especially so many African women, don't even know about cervical cancer and the dangers of cervical cancer. This is why I feel we all should know about, whether you are a man or a woman, because this cancer affects women does not mean that men cannot also know about it. You understand? Women get this cancer, get it through an infection. The infection is only gotten through intercourse, and that is why men should know about cervical cancer as well. Dr. Israel, over to you.
Okay. Dr. Fred don't talk so much about cervical cancer. In fact, that's just an introduction. So, to add to the introduction is that cervical cancer now one of the cancer when they quick catch women. In fact, not only women they catch, not only women they affect, and now women, elderly women, and yeah, elderly women. However, recently we even they notice say even young people, self, young women, don't they even they get cervical cancer. This is not because of our lifestyles and all those many things when we they do. So cervical cancer, it easy and it's also they dangerous. It is simple in the sense that it can be cured. Eh? That's one of the cancer when they will feel cure. However, you go only fit cure am when you quick present yourself, when you even quick know say yes, the cancer dey. And apart from say you go fit cure the cancer, it's also one of the cancer when we go fit prevent. Yeah, it's also one of the cancer when we fit prevent, because if you take the vaccine, based on wetin we don suspect say dey quick cause the cancer, when you take the vaccine against that virus, you go actually prevent against cervical cancer. And wetin we just dey talk cervical cancer, wetin be the service? Where be that service? Because most women also no know. We hear talk service. Most women no even know where that one dey. Now service na that mat, the mat of the womb. You know the womb when pikin dey. When doctor put am for inside the woman body, they say 2 cm, 3 cm. That part when they touch, now that they call service. Yeah, now be the mat of the womb, and that's the mat of the uterus, and now be like the beginning part of the uterus. So, and that part, it get different cells when they that side, and sometimes those cells can start to the malfunction, come they start to the misbehave. Sometimes because of say don't take when they're there, because of too many activities around that area, and the cells go fit come dey over exaggerate, come dey do wetin dem no send them. Some come dey comot from where they suppose dey, they enter where they no suppose dey. And when that thing don dey happen, this cell come dey multiply. And you know when cell don dey multiply more than as e suppose dey multiply, that one don become cancer. So when we don dey see those abnormal growth of those cells for the cervix, we now call am say this one na cervical cancer. Now, apart from say we just look all those ones, if you can't see the cancer like that, you also want to find out wetin really make this cancer happen. Yeah, wetin really make this cancer happen? Well, one thing you should know is that it is curable, it is preventable when you discover am on time. So that is why e good make we dey do the screening test, or make we take the vaccine to take prevent am, or to take quick know, so that make we fit treat am on time. Dr. Fred.
Yeah, thank you very much. You don't give us good supporting introduction. One thing where I say I go discuss for this class be say, or for this our live session or this conversation, anyone we won't call them, be say how women or how one woman go come take get cervical cancer. Because you go talk say and cancer, it just dey like that, but how the thing go take carry enter woman body? When they shout cancer, how woman take carry am? How we go say, okay, I dey listen to these doctors, but una never tell us. Now, the way woman take they get cervical cancer, now through infection. Yes, now I go lie for you. And the infection be say, now when woman meet man, when they do tata, mekwe, intercourse, now so they take they carry them. About 99%, some say 95, 99% of people will get them. Now through that infection, wey we dey call human papilloma virus. So when woman meets man, they make well. There's a chance say you fit near that infection. Now so, but the shocking thing be say, not be everybody where the infection enter their body, they come down with the cancer. I don't know if this thing where I talk now enter your head, so that may not talk say, oh, because I dey meet man now, I go get cervical cancer. No be so. Many women don't meet men, they don't make way up and down, like you get the point. And along the line, they don't collect the cancer and they don't collect the infection. That infection, not be everybody where the infection enter their body, they cause cancer, because sometimes your own body, your own immune system fit fight and destroy that infection. So you are okay, nothing go do you. But it gets some women, their immune system no fit clear that infection. The infection go come sit down for their body, go come sit down there, go 1 year, 2 years, 3 years, 4 years, 5 years, 10 years, 12, 15 years, like that. As e dey dey their body small small, e go come dey gather, dey change that place where e dey, go come carry the woman enter cancer area. So many women don contact this infection, but for some women, their own immune system help them clean am, they no know. While for some other women, their immune system could not fight this infection. E come sit down for there, e come spread, come cause them problem. Make I hand over to Dr. Israel, may he continue, so that in case you get any question for us, start to dey drop am now. We go dey answer all your questions, and share this video so that other women and men go come learn. Dr. Israel, over to you.
Okay, yeah, and Dr. Fred already talks. Say one of the risk factor now, person wey dey make well. So the thing is this, because that the virus when they cause am, when we dey call HPV, which is human papilloma virus, and the fit now through sexual intercourse, through knacking, now that fit dey transmit that virus. And one thing, another thing you should know about that virus is that even condom self not they protect against am, because just as contact with the skin of somebody where you get am, if the virus dey there, it can actually transmit to the next person. So it's like that. But as Dr. Fred talk, if your immune system is good, your immune system can actually fight it off and all that. But once you continue to infect yourself continuously with human papilloma virus, then it will become a problem. And another thing you should know is that human papilloma virus get different type. Yeah, they get different type. So you get the type when they cause, when go quickly lead to cancer. You get the type when they cause another disease, what they call what? So sometimes when you go do the test to find out which of the virus, which of the type the person body, if not the one where they cause cancer, they will need to quickly look for way to take treat and way to take handle the case, so that make it not lead to cancer. If not the one which they cause the what, they'll see try to look for how to take quickly handle and make it not cause that. So the major culprit, something where they hold say now they quickly cause am, now be that human papilloma virus. So there are other things where they look as risk factors. So these things go predispose us to quickly get this human papilloma virus. What can make us come down with the cancer. One of them now weaken immune system. So when person immune system they weaken, like because of maybe some illness, chronic illness where the person get, or the person they take some kind of medication where they reduce their immune system, if it can make them get that human papilloma virus, or if it can make the human papilloma virus when they don't even get for their system can reactivate again, and then you can't get power to take do one or two things for the body. HIV, once somebody HIV now one of the things where they reduce the immune system very well. So once he reduce the immune system, most HIV patients they prone to get human papilloma virus disease. Now another thing is smoking. People when they smoke, they quick get the cancer, cervical cancer as well. Another thing now alcohol. So alcohol have also been seen, and it has also been shown that people when they take alcohol, and women when they take alcohol, they see the quick come down with human papilloma virus. Then another risk factor now, people when quick start to the knack, they quick start to the knack. All those ones, they quick, because they quick start to the knack, it means that they quick open themselves to acquisition of this human papilloma virus, and then they go feel quick get the cancer. And apart from the saying they quick start to the knack, people when can get multiple knacking partner, me say they not get only one person, they get a lot of persons. All those people see they at higher risk of coming down with cervical cancer. and they have higher risks of coming down with cervical cancer. So these are some of the risk factors and the cause of human papilloma virus. History of cervical cancer. So,
Thank
Dr.
you,
Fred.
Dr. Israel. Yes, yes, thank you very much. If you just they come, we they talk about cervical cancer, understanding cervical cancer. Now we they discuss today. So share this video, make other women and men come learn about this cancer. Where they buy our women, the fourth most common cancer in women all over the world. They buy women well. And the thing again, we don't talk, say you can prevent it, you can treat it, you can avoid it. And I can see that we have a question here. But before I go to the question, Betty, thank you so much on YouTube. My people for YouTube, share this video, invite your YouTube friend, give this video like, thumbs up. For Facebook, like this video. More people may they come see them. Thank you so much for this recharge card when you send, give us. Thank you so much. God bless you. We truly, truly appreciate. Yes, so thank you. Okay, now we get one question here from Dr. Success. May we take this question, Dr. Israel? He said, my daughter is 16 plus and has never met a man. Can she take the vaccine? Because we mentioned the vaccine, right? We talk about can she take the vaccine? We go prevent her, make she no come down with this problem later in the future. Oh yeah, may we respond, I beg.
Okay, yeah, because he never meets a man, never meet anybody. Yes, she can actually take the vaccine. Yeah, we actually they come to that aspect because we'll go see talk. We will actually talk about the vaccine small. We'll just talk small about the vaccine. So this is one of the things. Yes, he can actually take the vaccine, and when he take the vaccine, yeah, the vaccine will actually prevent her from coming down with to acquire the human papilloma virus when go can lead to get cervical cancer. And I can still remember that in Nigeria, even I think even up to now, they still they give women they say they give women, but a time will come when they say they go limit them to only children, only children within the age of 8, so a time they come, in fact they suppose don't limit them, maybe because they see they look and say a lot of our women never still take the vaccine. That's why when you go to health centers and all that for Nigeria, they go still give you. I believe even outside the world, apart, even though you not be small picking, you don't big, they still give you. Now, even when you don't even the make well, you don't make well, you go still take the vaccine in the sense that they can actually do the test, you check, you screen for HPV. When they screen for HPV and you are free of HPV, it means that you not get HPV, you can still take the vaccine. Because once you take the vaccine, it means that you are not protecting yourself against the virus. Then you know that yes, you are safe. So yes, the child of 16 or the child of 16 can actually take the vaccine.
Thank you. I beg, share this video. Share this video quick. Make more people make them come watch. Share. If you never share, why? I they look right now, and I see say now only few people now don't actually share this video. I ask myself why. Is it that what we talk no make sense? Yeah, now to add to waiting Dr. Israel talk, the age is from 9, they say now 9 to 14 years. 9 to 14 years, girls, and they give. But that does not mean say if you're picking there above that age, excuse me, and you won't give them the vaccine, you know if you give them. Just like Dr. Israel talk, even some ladies where they 20, they still collect them. Now the truth is that this HPV they cause a lot of problem, not just only cervical cancer. Some people can't look say if we give these people this vaccine, if we still help them, see if we protect them later for other types of problem too, with that virus because so that they say, okay, may we also waiting, may we give them. So if you want to give your daughter, I beg you, if you give them from 9 years to 14 years. But then say if you're picking day less than 9 years, say make you never start. Now because that they try maximize the age, the availability, and a whole lot of things. Now, how woman go take know, say this cancer it don't enter her body? A lot of women no go know. The cancer go dey their body, e no go give them sign, e go dey cause problem for their body, dem no go know. E go dey chop their body small small, the woman no go know. Later, by the time the thing don come spread, don cause severe problem, the woman go come hospital. By that time, na when e don late, wetin dem fit do take treat am, e don dey very late. So most women no go even know. That is why we dey talk now, say as a woman, you no even need to wait make you dey see symptom for your body before you go even screen yourself, before you go test yourself. Because now when you go do screening, then we fit pick am very early to know, say okay, something like this dey your body, make we start to treat am. Because as Africans, we dey only wait when problem don go far before we go hospital, which is very wrong. So one thing be say the woman fit no even know at all, say this thing dey her body. And that one be say, if it affect the woman and her period, she fit just dey, her period will come dey do one kind, she no go understand again. Wetin dey make am pain us be say, instead of make this woman go hospital see doctor, she go dey ask people for market, she go dey ask her friend for church, she go dey ask people for the internet, she no go enter hospital. By that time, when she go come go hospital, the thing fit don cause problem. Make I also hand over to Dr. Israel again, may we just touch more on this, then we'll talk about the prevention and we take more questions. So over to you.
Okay, now waiting Dr. Fred they try to talk, we don't enter the signs and symptoms. So waiting person fit see to know, say yes, maybe na cervical cancer be this. As we Dr. Fred first talk, the early stage, they get sign, and you not go feel anything. There's no symptom there. That's why there's a screening test, and that's why they talk about the screening test. That's why you need to screen yourself as a woman. You need to screen yourself at least every 3 years to find that if anything like that don't they or not. Yeah. But if you don't see signs and symptoms, you don't see some of the signs and symptoms when I want to mention, say it means say you go to check yourself, and sometimes it means say the cancer don't they go the late, they go the late stage already. And if you don't reach the late stage, note they may not be able to cure it again at the late stage. So what be the things when person fit see? You can't bleed in between a period. So you see a period now, before you know you start to see another blood. Before you know, period will come again, which was never the way we infected see them before. Sometimes after a knack or during when it knack, you go see blood go come out, which is not supposed to be. And another one, some women don't enter menopause already. That is, they know they see their menses again. Once or you're shocked, they just start to bleed, which is not supposed to be. So once you start to see all those things, you don't say, oh, I beg, I need to go check myself. I need to see a gynecologist, doctors who they specialize in women to find out what really they have. And sometimes for those when they see their menses, sometimes their menses become very heavy. Yeah, they become very heavy, and you can't see for longer than the way when they first they see. Sometimes, as Dr. Fred told, the menses will come, they do like who not fit stay one place again. And this month you'll see for 3 days, the other month just like that, you just can become irregular overnight. Then sometimes you can see some kind of discharge they come out from your body when you don't understand. Very unusual discharge. Yeah, that when you they see. And then when you they knack, you go they get pain. And during knacking, you go they feel pain. But then even your waist, you go they feel pain. All those kind of things. When you start to they notice I beg, you need to go check yourself. Then some of people go they get backache, you go they get swollen leg, their legs go they swell. Then sometimes this one because all this one when I don't mention, say the thing don't they go far, don't go far. Sometimes they find it difficult to peace, and they not go even feel peace or even feel go toilet. Sometimes they not go feel do all those ones. Sometimes before you know it, if they eat small, they say they don't belly full. If they eat small, they don't belly full. Before they walk out from here reach here, they don't tire. Yeah. Sometimes they even they get waist pain, body pain, and just like that, different things. And if this cancer don't move, come off from the primary site, because sometimes the cancer being move, come off from that primary site, can't go other part of the body. So when it touch every other part of the body, whatever part of the body when it touch, the symptoms when follow that part, the person on the notice those things. So all these symptoms when we measure, all these signs or symptoms when we measure, and these are now some of it when person feel notice. And then when you notice all these things, me say, please go and check yourself. Go and check yourself. Not be the time to go and Google, or not be the time when you come go to look for your brother or sister, make he tell you what he use when he won't be like that, and not be the time. So you go to the hospital, see a doctor when they specialize in women, and then other things will follow. However, if you screen yourself right from time, it may never get to that period of time before you know that, oh, something has happened, and then you go fit treat am. Dr. Fred.
Yes, thank you very much, Dr. Israel. I see you don't really break down the symptoms. If you watch us, we talk about cervical cancer. But I noticed say you never share this live session. And I don't understand why. Why are you not sharing? Is it that we know they try, but we they talk no make sense? Hello, sir. Hello, ma. Share now. Maybe more people can learn. Now, I see some comments here. I see some questions. May we take the questions and then we go continue again. Somebody they ask us question here. And the person, your name now, Queen say, for those women that the virus has stayed long in their body, if they receive the vaccine, will it fight the existing virus in the body, in their body? This is a very good question, a very technical question. Now, if you listen to what we talk, before I bring the Israel, also add one or two. We talk say the vaccine not to give people where we say the virus never enter their body at all. We go give them. Now, before you go can't even take the vaccine, especially if you don't meet man, you go first need to test yourself first. May we know whether you get this virus or it don't they cause you problem for your body first. Because without you knowing, you go just go take the vaccine. You don't go know where you dey, whether you dey safe or it don't they cause problem. When you don't do this check, we can't see, say, this thing, in all day, take vaccine. Oh, this thing day, it don't they cause you problem. Small, we go address the problem. Can you still take the vaccine? You can still take it. Nobody go talk, say, may you not take it because, oh, we saw this thing. However, the protection where it go give you, the protection no go be like those people wey never get them at all. Because yes, I have seen comments like that, and even when I was listening to one of the WHO and their knowledge sharing sessions, if the virus dey the woman body, the HPV virus, they have checked, they are starting managing, they're not going to deny you the vaccine, just that the protection wey you go enjoy, or that thing wey the thing go give you, where you say as you take am, e no go be like person wey never enter their body at all. I don't know if it makes sense. Okay, we get one more question. Make I allow Dr. Israel respond. He say, my daughter is 10 years and has taken the vaccine. Hope it is okay.
Yeah, it's very okay. As far as your daughter have taken the vaccine, yeah, it's very okay. Yeah, there's nothing bad for her to from that age. With all your the age is from 9 years, so your daughter is 10. So your daughter is very safe to take the vaccine.
Okay, another question for here. Good evening, sir. They told us that the vaccine is only for female at 9 years. May Dr. Israel help you correct that thing.
Okay, yeah. For Nigeria, because of the availability and the number of vial of vaccine when they make that they give just women. And would they say, yeah, from 9 to 14 years, not just 9 years only, 9 to 14 years, or even more than, even up to 15, say, fit taker. And remember, we also doctor you say, even when you are more than that age, you can still take it. You can still take it. Sometimes the dosage may be different. Than I wanted, the dosage may be different from those 9 to 14 years dosage. And yes, for Nigeria, would they give just women for now? The reason is because of the availability of the vaccine. And they also see and say now women I need and pass because now then they pass through the problem. Yeah. So now make the same make that they give women. However, if you have a male child and you can sponsor for him to get the vaccine, it's not bad. Because what we talk, we say now through knacking and they take the quick get the virus. So it is better to protect both the male and the female. Shey? Yes. But sometimes why they just say now female for mainly for Nigeria is because of the availability. So that and now because now women now see the vulnerable pass and now then they carry the problem. If the cervical cancer happen, now who want get the cervical cancer? Now woman. So then it's okay. Let them vaccinate women first, and make the first just help women because of the limited of resources. But as I said, if you see a place when they say may you vaccinate your male and you get the resources to take vaccinate your male child, please do it. Is your male child also need them?
Thank you. Your in the year so, in the year so, I beg. Now, since we dey talk about the vaccine, may we just enter there. May we also talk from one other thing again where I want add. And that is, I don't see if somebody call me. He say, doctor, I hear say that they share this vaccine for my pikin in school. Oh. Make I give my pikin. Hope say you know go make my pikin no born in the future because people they talk say that they give our children because they no want make them born in the future. I don't want to. Now I say make I kuku tell you right now. The vaccine is safe. Oh. The vaccine no go affect your pikin, make your pikin no fit born in the future. Rather, if you no give your pikin now, you no give your girl child, she can't develop the cancer in the future. She no go forgive you. Because this thing they available. Wetin make my mama no give me? Oh, my mama they listen to then say, then say, then say, then say. And then in the future, she go see some other young ladies. Those ones are fine. Those ones are safe. But because of her mama, we no seek proper medical counsel, proper medical advice. E go dey listen to wetin people dey talk. She can't go get the problem. She not go forgive you. That is why I say make I kuku talk this one now. May you hear oh, e no go affect me your pikin no born in the future. You no go do anything like that. Rather, your pikin go thank you when your pikin don't grow. Say, thank God, oh, my papa and mama then do this one for me. I don't know if you won't add anything again to this. And if you get more questions, oh yeah, start with the drop
Okay,
and
yeah.
we'll go take your questions.
Okay, yeah. That not true because once vaccine come like this, there are so many myths, so many misconceptions when they follow those vaccines. They come, every vaccine you hear one thing will just come out from nowhere about the vaccine, something when you never hear before. I used to get the time when we offer hear this particular one. I was not happy. And the funny thing is that this HPV vaccine don't day for a very long time before that they pay to get and don't be small money. That time when they pay to get and nobody talk about one thing about them. But when they come make them free for this our young ones, now people come out. Now one person come and say, hey, they know want make your picking born again, oh, this and this. So not be truth. Not be truth. Oh, it's good for you to know that one say not be truth at all. So it's just to prevent HPV, to prevent the virus when it cause problem for your picking in the future. So apart from HPV, what would they talk about? Get the vaccine, HPV vaccine, and all that. They get other things wey we fit take prevent the cervical cancer, which are screening tests. And we need to dey do screening test. And the screening test now we dey call the pap smell or the pap test, or even the HPV screening. So this one you will use am take screen for the HPV itself, while the other one you will use am take check whether there's a different, whether there's something wrong within the cervical wall, within the cervical wall. So when you check the cells of the cervix and see if there's any changes. And then if there's changes, you quickly treat them. If there's no changes, you tell the person to come back so time for the check. Yeah, for the check. So for women within the childbearing age till they reach 65, and it's supposed to check am, and they check am at least every 3 years. Why some people say you can check for every 2 years, and depends on the condition. That's for your pap smear or HPV. Now, when they check the HPV, they go want also do the typing of the HPV. When they do HPV screening, if the person gets the HPV, they go do the typing. That is, they want to know the type when this person get. Now, the one will go quick cause cancer, or now the one when fit cause what. So and whatever the one where they see, so that when they know they go fit manage am. So this regular screening, regular testing, this one are very important for most persons wey no go fit take the HPV vaccine. Yeah, you know, say we talk say, oh, now young people, but so, and maybe you now do not get access to the HPV vaccine. This screening test is very, very important for you. Yeah, it's very important for you, so that you dey screen yourself, you dey check yourself to make sure say you not get come down with cervical cancer. But once you check and finish, if there's anything, they go quick manage am. So that even when the cancer don dey, but e dey in stage 1 or e dey the earliest stage 0, they go quick cure am for you, so that make nothing happen to you. Because we don't tell you say this cancer now one of the cancer that is curable, but it can only be cured when you detect am on time. And the only way when you fit detect am now through all these screening tests when we don't talk about. So, Dr. Fred.
Yeah, so you don't hear, oh, now only through the screening test. Now we fit take no be when you gather, they listen to people, they tell you other things. No, now only when you check, because if you no check, you no go know. How if it prevent this thing? How? Make I just take one or two comments. We get Madam Juliet Nibel, say for Germany, is given to children at the age from 9 years old and adults from 9 to 15. You take 2 doses. After 15 years and above, 3 doses. And depends. Different country with their different guidelines now. Some country will get money, if you pay for enough dose, they go give them. Some country will not to get enough money, they don't still do research. Say, if we give people 1 or if we give people 2 like this. So thank you for this comments, Madam Juliet. Now, this comment, we don't answer them before. Chisom says,
and also, sorry, Dr. Fred. And also, it depends on the type of the vaccine when you want give, and the make of the vaccine. Then go see determine the dose. Just like when would they give COVID vaccine? You know, say some people when they take some now 2 doses they take, while some people now just one dose. So it still depends on the kind of vaccine when you take. Yeah, Dr. Fred.
Yeah, thank you for that. For those women, I beg, share this video, share, make women come learn, I beg. For those women that has the virus in their system, if they take the vaccine, will it destroy the existing virus in their body? Now, Chisom, they ask this one, Dr. Israel, I beg, help us.
Yeah, just as Dr. Fred actually answer this question when that person talks, say people will fair get the virus, don't take for their body, they can't take the vaccine. If you go see protect them, it's just the same thing. So even though when they take the vaccine, I think this set of people still need to do the screening to make sure say they know say they not come down with cancer, because that vaccine is not a treatment to HPV. Is a vaccine, not be to cure HPV. It's a vaccine to prevent it from happening. So somebody who already infected, it's just like it's trying to build your immune system against the disease, so that once it comes, they fight and they kill am once. Yeah. Now you already get them for your body. If the vaccine come, it not go just it already did there. It already did there. So that is it. So the major thing is to now start continue your screening test to be sure say you no go come down with anything and when go affect you.
Okay, may we take one more question from Margaret Daniel. If a woman collect the vaccine, I believe this vaccine 2 times, are there any side effects?
So it's good to stick to the dose of how they tell you may you take the vaccine. It actually does not mean that there will always be any side effect, but you remember say there's no medication or there's no treatment will not get side effects. So it's good to stick to how we tell you say take them so that you know will give yourself a problem.
Yeah, thank you for this. Very good question. Now, one more. This person, Cynthia, they ask us. Cynthia say, is it free for women above 14 years?
For most places when I don't see say they give above 14 years, for some places when I don't see they pay some certain amount of money. But when they first start to they do the campaign, when they first bring upon Nigeria, like I think it's 2 years ago or last year, I think it's 2 years ago, when they first bring and come, when they start the campaign, it was free then, and it was free then. But now, because now they don't narrow and down to just those children between the age of 9 to 14 years. Every other person with there above that, sometimes you have to pay something to get the vaccine, and it also depend on where you they go get the vaccine, and where you they go get the vaccine will actually see determine that as well.
Thank you for this response, Dr. Israel. Now, as we try to round up, first of all, before I forget, for those people where they disturb me, doctor, I want to learn content creation. I want to be posting on social media, but I don't know how to do them. I beg, guide me. I beg, teach me. I know that. I beg. Listen. Look this your screen now. Carry your phone, scan this code. If you know if you scan them, tell me. I will give you the link. When you go buy the course, watch all the video for there. It will help you. Watch all the video. You go know how to do them. You go know how to carry your phone, how to talk, waiting to talk, how to do. May you know also enter problem online. May your page no get problem. So go get this course now. And when you get them, if you ask me anything about this, I go also they answer you, they guide you. Whether they do business, so no, they wait for shop, also they post online. Yeah, go get the course now. And if you won't get them and you don't know how to do them, drop comment. I will give you the link so that you go get them. Now, Dr. Israel, as we want to round up tonight, how we go content prevent this cancer, make it no touch us? We don't mention vaccine. We don't talk about vaccine. How to give our girl child, how to give those we also they above that age, how to go for tests. We don't talk about we don't talk how we take give boys as well. But we get other ways where we fit take prevent this cervical cancer, make it no cause problem for our women, our people body. One of them, be say, take care of your immune system. I don't want to talk the other one. I will let Dr. Izeme talk am. Take care of your immune system. Anything will go bring down your immune system, go expose your body to attack, to danger. Because when your immune system is weak, any infection will enter, like this virus now, your immune system might not be able to destroy it at all. And when it enters, it sit down for there, you will become landlord, they multiply inside your body. Take care of your immune. How do we do that? We don't talk about them before. The video there, our page. Take care of your immune system. Do you hear me? So, Dr. Israel, over to you.
Yeah, that's the first thing. Take care of your immune system, because your immune system can actually fight the virus itself. So when your immune system is good, it's very good. And so many things when we they do when we reduce our immune system, and those are the things where we also need to stop. When we talk about the risk factors, things when we predispose us to get this cervical cancer. So those are the things we also need to watch, like smoking. Stop smoking. Yeah, stop smoking. Stop taking alcohol. Must it makes sense say one you get a single partner. So I cannot control when you start to the knack. Yeah, I cannot control that. But the number of partners when you get, you can actually control that. So control the number of partners when you get. Use protective measures. And as we'd already talked, vaccinate yourself. It's very, very important. One thing you should know about this vaccine is that apart from say the vaccine they protect against human papilloma virus. That is, they protect against the acquisition of cervical cancer. You see, they protect against so many other different kind of cancer, even anal cancer, throat, and even throat cancer, even the what when we even mention these vaccines still they protect against them. So that's to tell you that this vaccine is important. It's important. It does not only work against the cervical cancer, it still get other things when they work for. So it is recommended that we take the vaccine. For the women, we take the vaccine, and the ladies between the age of 9 to 14, you take the vaccine. But if you don't miss at that time, you can still take it even to the age of 26 or even 45 years, depend on the policies and the country when you dey. Yeah, depend on that. And the dosage still different for this from this age group. As we said, this vaccine for some time, for some places it may be free, but for some places you will need to buy. We need to buy the vaccine. So not be everything that will give you, they will give us free. So maybe we not just think say that maybe we not just say na punishment. No, not be punishment. Now I know say you don't hear say every little thing we they say stop this, stop this. Mostly alcohol. Most people don't hear us stop alcohol like 1 million times. It's because for now for your own good. It's not like we ourselves defend we just like to the talk and say stop this, stop this. Because to your mind now, alcohol they cause a lot of things. Yes, they cause a lot of things. And you not get anything when they give anybody. Dr. Fred.
Okay, oh, make I not put mouth on top, make I leave her like that. Yeah, somebody was asking me, he says, Brenda, hi, doctor, please, I need link. Yeah, so I've responded. I don't drop the link. You go see these comments. Now me drop them. Guide for new content creators. This course will help you decide if you need to be a content creator and what type of content you need to create. It will help you avoid pitfalls and a whole lot. So the link did there. Just click them, no fear. Now me put them for there. Now me put them. No, now me. So click on them, pay. It go show you videos where I don't do to help you. Okay. Now we don't talk. Somebody says, thank you, doctors. We appreciate you guys. Thank you very, very much. As we round up, this program, don't forget, now every Sunday. We don't do them like 6 years now, by the grace of God. Myself and Dr. Israel for 6 years, every Sunday. Now, today they play football final, but we know, say some women, they will need this information. Some parents, they where this thing will help. Now make us come here like this. Do you understand? And now so we they come. For that 6 years, if we never come, maybe now 5 times, maybe because of some 1 or 2 issue, 5 times. You never, maybe. But other than that, we are here every Sunday by 8 p.m. to 9 p.m. You go meet us here. We go teach, we dey answer questions. And today we dey talk about cervical cancer. Next time, we fit answer questions generally, but today's own topic, we dey focus on cervical cancer. So as we try to round up right now, wetin I want to talk be say, e no go good make wetin we fit prevent, make e knack us. E get, honestly, as human beings, not be everything we fit prevent, make I no lie you. Not be everything, but you get some few things where you know by yourself that I can avoid these things. That one now we dey talk about today. One of them, and this type of cancer. So if you're a woman, you are a man, you are a father, you are a mother, you are a guardian, anything where you be, you feel help our next generation. You feel prevent them, make this cancer no by women. You feel prevent, make them not get other cancers by doing what? Oh yeah, everybody, give your pikin this vaccine. Madam, teach your daughters, teach your sons, make them also know they until they don't mature, until their brain don't mature. Guide them, because when you expose yourself to this intercourse, knacking early, you also expose yourself to the risk early. When you go to get multiple partners, you they put yourself for danger. Many things where you say you don't have to be a doctor to know all this one. Now here I won't stop. Make I allow Dr. Israel make it do in job of giving us the summary.
Mhm. Okay. As we talk the summary, I go just try to pull up for one question when I also see on the comment box when you talk about now be say all the Olosho don't get cervical cancer finish. I think it's
Mm-mm.
Dr. Success ask the question. So
Yeah, yeah, yeah.
we today we just try to talk about cervical cancer. We say make we understand what is cervical cancer be and how we go fit protect ourselves and prevent from happening to us. And we start by saying that cervical cancer an abnormal growth of cells in the cervix. And what will be the cervix? We say the cervix now be that mat of the womb or the mat of the uterus, where pikin they pass come out. And we say that part they pass through so many activities. So that place, sometimes the cells when they start to misbehave. And one of the things when people make them start to misbehave, that be the human papilloma virus, when be the causative agent, the major culprit when they lead to cervical cancer. So human papilloma virus na virus when they go fit get through knacking and through knacking. So now we come to talk say you also need to protect yourself so that make person not get that through knacking. We also let you know say cervical cancer now one of the cancer when they fit cure and now also one of the cancer when they preventable. But you go fit cure am only if you find out on time. And to find out on time, that be say you need to dey do screening test and you need to dey check yourself very well. And how you fit take prevent am na to take vaccine to prevent against the cause of cervical cancer, which is the human papilloma virus. And apart from that, you also need to stop all the things wey be the risk factors. And one of them na taking of alcohol, taking smoking, yeah, person wey go start to dey knack on time, get multiple knacking partner, and anything wey go fit reduce your immune system. So when you fit work on these things, when you fit work on these when you fit work on these things, you would have prevent yourself from coming down with cervical cancer. And then we say wetin be the signs and symptoms? And we say for the beginning, cervical cancer for at the early stage, e no get signs and symptoms. You no go even know say the person don get am. But once you start to dey get signs and symptoms, e mean say the stage don dey go the late stage. And what fit be the signs and symptoms? You dey see blood unnecessary when you no suppose see am. Yeah, you dey see the person dey bleed when e no suppose bleed. After im medicine, you pass say e still dey see blood. Sometimes during knacking, e dey see blood. He don enter in menopause o, e go surprise say e come still dey bleed. Then sometimes the menses go come dey very heavy and e go dey long and e go dey irregular. Sometimes you dey get some kind funny discharge when dey come out from the body, very unusual. Sometimes you go dey get pain during knacking. Even the waist go dey pain am well well. Sometimes you go get back pain, leg swelling. Sometimes you no go fit go toilet, you no go fit piss, and so on and so forth. So we come talk say all these things we can actually prevent it by just taking the human papilloma virus vaccine. So when you take the vaccine, you can actually prevent most of these things. And we say, who fit take this vaccine? Young adults, children, female children between the age of 9 to 14. These are not the primary persons wey get the vaccine. However, other people fit still take the vaccine until they get to the age of 45. Yeah, they fit still take the vaccine. And we say the vaccine not be only cervical cancer e dey prevent against, so even throat cancer, anal cancer, and even what it go also prevent against these things. And we say apart from taking the vaccine, you also need to dey do screening test. You need to dey screen yourself, which is the pap smear and the HPV screening. So when you screen yourself, anything when they see for the screening, go let them know what and what to do for you. And this screening, you can do the screening till the age 65 to the age 65 years. And sometimes you need to do the screening at least once in every three years for women. Now we can't talk about men in terms of taking of the vaccine. And we say yes, men fit still take the vaccine because but for Nigeria, we only they give only female, but men fit take the vaccine. Now, this brings me to that Olosho matter. Yes, if it be say most of the Olosho fit come down with cervical cancer, yes, it's possible because of the multiple knacking partner and all that. However, do you also know that most of this Olosho now then take care of their self pass? Some of them some of them don't already know of this cervical cancer screening. Some of them don't even take the vaccine. Some of them they do their screening every time to make sure say they not come down with these things. Because remember, now they vaccine they get their money when they take they survive. So whatever they take they work, they go also want to protect them very well. Yes, it's part of the risk factor, but you'll be surprised that most of them actually are taking care of themselves more than others we no even know of it. We know they take care of themselves. I think na year ago, and I think na year ago end. I think I've said a lot. So thank you, Dr. Fred.
Thank you so much. Thank you very much, Dr. Israel, and thank you for watching. I get one comment where I see somebody says, "Thank you, doctors. There is no share." There's an arrow there. Valerie Mark de Gaulle. If you look at the live session, if you click on it, you will see that there is an arrow somehow, I think on the left side, just an arrow pointing to the right. The arrow is pointing to the right. So when you tap on that, yes, when you tap, it's curved, a curved arrow. When you tap on it, you can share. I need you to share this video. Save people. You understand? People need this information. Not every time we go they dance online, we go they laugh. We need life-changing information. And I'm grateful that you are here. You spent your data here. We don't take it for granted at all. Thank you so much for all your questions, all the comments. And in case we no answer, you not vex. Now, because say your question, we know they related to the topic tonight. And finally, I want to appreciate Betsy for YouTube. Those way they YouTube, Betty send us 1,000 naira from YouTube. You can see there. So thank you so much, Betty, and God bless you. We will be here again next Sunday. No come late, 8 p.m. to 9 p.m. We know they use time play for here. 8 p.m. to 9 p.m. If you come late, you go miss. Like I always tell you, finally, happy birthday to Dr. Israel once again. I they can't collect my own. Happy birthday. Remember, good life.
Thank you so much.
Good life. So go and get your course. Get your course for all those that want to do content creation. Get this course. It will help you. Get it. I say, may you get and may you no suffer. Now me do them, and it will help you. See you next week and have a wonderful day.